In today's Morning Rounds, how heart disease is a major risk for pregnant women. Today is the American Heart Association's Go Red for Women Day. Heart disease kills nearly 420,000 women in the U.S. each year. It's the leading cause of death among women. The disease is the #1 cause of maternal deaths. A recent study found about 1 in 4 pregnancy or postpartum deaths are caused by cardiovascular complications. Our Dr. Tara Narula, who's a cardiologist, spoke to one woman who had a potentially life-threatening heart complication during her pregnancy. Dr. Narula, good morning.
Good morning, Jerika. The mortality numbers are even more staggering for African-American mothers. Their risk of dying from heart-related complications is 3 times higher than white women. We spoke to a first-time mother who was diagnosed with hypertension during her pregnancy, and once she learned her condition could lead to serious future complications, she changed her life around. This was Michelle Amiibo in 2014. She and her husband Marcus were expecting their first child. Just like all new parents, they worried about the health of their baby. But Amiibo received unexpected news in her 3rd trimester during a routine visit with her obstetrician about her own health.
She told me that my blood pressure was extremely high.
Amiibo says that moment changed her life forever.
And it was pretty alarming. When I went back the following week and my pressure was still high, that's when I knew there was something wrong.
Amiibo was diagnosed with gestational hypertension. It's also known as high blood pressure that develops during pregnancy after 20 weeks. In severe cases, it can cause preeclampsia or eclampsia, a pregnancy complication that can be fatal to the baby and the mother. Hypertensive disorders can affect as many as 1 in 10 women and can increase risk of heart failure, heart attack, and stroke.
I really don't know what caused the hypertension. So I know I had gained a lot of weight. The only thing I knew was that I had hypertension and that hopefully after giving birth to my daughter, everything would go back to normal. And it just did not.
4 months after giving birth to her daughter, Sarai, Amiibo struggled to get her blood pressure under control. Her weight skyrocketed, and her new normal was chronic postpartum hypertension and a daily blood pressure pill. You didn't expect to have a diagnosis of postpartum hypertension.
No, and I didn't even know there was a thing called postpartum hypertension.
Risk factors for cardiovascular disease-related maternal mortality are race, ethnicity, age, hypertension, and obesity. Women who are diagnosed with hypertension during pregnancy are then at a higher risk for high blood pressure and cardiovascular disease in the future.
The number of maternal mortalities in the U.S. is actually increasing.
Dr. Catherine Weinberg is a cardiologist at Lenox Hill Hospital.
We're seeing that there's actually an increase in the number of heart attacks during pregnancy, and that number is going up in the United States. We don't exactly understand why. We also sometimes unmask disorders that we didn't realize were present before.
You're doing great.
Amiibo got serious about her health. She works out at least 5 days a week, has cut sodium out of her diet, and portion controls all her meals. Do you feel like having your daughter helped push you and motivate you?
Oh, absolutely. Yeah, I want to be healthy for my daughter, but it was also too for me. I'm not just Sarai's mom. I'm Michelle too, and I have to take care of myself.
She worked hard for 4 years to lose 75 pounds, and since last winter, she no longer needs blood pressure medicine.
When you think of heart disease, you think of heart attack, you think of stroke. Hypertension is a real issue, and cardiovascular disease while pregnant is a real issue. We have to get the information out there for moms and for families.
Michelle Amiibo is now a spokeswoman for the American Heart Association and hopes her story will help other women know the risks. You know, one of the things she said to me was, I can't believe I was chosen to be a spokeswoman because all I had was gestational hypertension. I didn't have a heart attack or a stroke. Yeah. Right. And that just conveys the idea that most women don't really think this is a big deal.
And Dr. Narula, what are some of the signs of that hypertension and what should one do? We saw Michelle was able to lose a lot of weight and she's eating healthier, but what should people do?
Well, if you're diagnosed, certainly you need close follow-up during pregnancy. And then I think one of the big things is a plan after pregnancy. You really need to meet with a cardiologist in 3 months or so to go over all of your risk factors. You need to know your numbers. The issue is during pregnancy and even in general, hypertension can be silent. So you may not feel anything, but certainly in pregnancy, sometimes it's hard to tease out. You may feel short of breath or have leg swelling and you just think that's normal pregnancy, but sometimes it can be a marker of a bigger problem. So you need to speak up, speak to your OB and potentially, get referred further on to a cardiologist if need be.
The way Michelle has responded is so impressive. I mean, are there ways to prevent heart disease during pregnancy?
Well, there's ways to prevent heart disease in general, which is is what we try to educate people, that 80% of cardiovascular disease is preventable. So things like, as you saw, diet and exercise and stress management, all of these things can go a really long way. So,
all right, Tara, thank you very much.
Thank you.
Very impressive story.